Well, good morning. I guess good afternoon now, safety fanatics, and welcome to our virtual work panel. My name is Max Victor, and I am the upcoming head of school for CFS and today's panel host. Thank you for joining us. We'll be covering the topic of summer fun and safety. Those are two of my favorite topics. One exciting thing before we begin, just know that we're listening to your feedback. We will be opening up the chat box today for live questions. We'll start hearing those questions from our CFS parents and others that are in the chat. We'll be fielding live questions during the course of the panel. So please start sending in those questions to the experts. Now I'd like to briefly turn things over to Matt North, a dear friend of mine. He's going to remind us today why we put this panel together and what we're hoping our safety fanatics can take away from it. Matt?
Hey, everybody. I am Matt North. I'm the IT director here at Christian Fellowship School. I'm also a soccer coach and a parent of 3 kids that are very busy this summer. So I'm actually really excited to see what comes out of this panel and hopefully come up with some new ideas. We've also heard a lot of feedback from our parents about just a lot of questions. So that's kind of what we're after today, is really just to address some of those and come out the other side of it, maybe with some new ideas. Enjoy the panel.
Right. Thank you, Matt. Thanks for sharing that. All right, and please join me in welcoming our panelists. Panel members, if you could please introduce yourselves. We'll start with our first guest expert who has helped put this whole thing together. Please, let's turn our attention to Stephen McBee.
Hey, welcome everybody. I'm excited to be here. My name is Stephen McBee. I'm the Director of Engagement at Christian Fellowship School. I've been married for, next month will be 27 years. My wife and I, we have 2 children. I have a son who's 20 and a daughter who is 17. And my son lives in St. Louis. He's an IT guy. My daughter's a senior, and she plays all kinds of musical instruments and wants to go into neuroscience. And so a lot of the stuff that I'll be sharing on the fun side has come from our own personal family experiences. I've also been involved with teenagers and children on one level or another for professionally for about 25 years now. And so I've ran camps and, been camp counselor and all that stuff for many years. I've had a great time. And so I'm happy to be here.
All right, thanks, Stephen. We're happy to have you. Dr. Ilbudo, will you please introduce yourself?
Hello, I am Crystal Ilbudo. I'm a pediatric infectious disease physician here at MU. I've been here for 5 years. I'm also a mom of 3 very active kids, twins that are 6 years old and a 20-month-old baby.
Well, thank you for being here. Now we have our CFS parent panelists. We'll start with Brad Lodeman.
All right, so hello, I'm Brad Lodeman. I work for the Missouri After School Network. It's part of the University of Missouri Extension. So that's my job. We provide training and resources for after-school programs across the state. I actually graduated from Christian Fellowship School. I've started telling people in the late 1900s, which makes me sound way older than I really am. But I graduated from CFS. I've had 2 children graduate in the last 3 years or so. And then my youngest son is going to be a sophomore at CFS this year. So happy to be here and be part of this conversation.
Yeah, thanks for being part, Brad. And now let's hear from Kim Toma.
Hi, my name is Kim Toma, and I live in Columbia. I've been at I've worked at Christian Fellowship for 10 years. I have a 20-year-old son that graduated from here. So he started here in kindergarten in 2005. I have a son that is 15 and he'll be a sophomore. I also consider all the students my children. So I'm excited to hear some ideas and things to share with them for the summer months.
Thanks, Kim. I also am excited. Well, if you're just joining us now, this is the Summer Fun and Safety panel for all of our safety fanatics. I'm Max Victor. This is Christian Fellowship School with Dr. Ilbudo. So thank you for joining us, panel members. We get into our questions. Before we get there, we want to talk a little bit about the tips we will be providing during the course of the panel. As we all know, the information regarding COVID-19 is an ever-evolving situation. It's rapidly changing every day. Dr. Ilbudo has represented MU in a number of media appearances. It's important to remember tips and recommendations we'll share today may change in the days and weeks to come. We'll be answering your questions with the most up-to-date information that we have. So please visit the My CFS page on our school website. You can find that up in the corner when you visit cfsnice.org, and our COVID-19 Community Health and Safety Center for more COVID-19 resources. I think we're ready to jump into the questions, guys. Our team members have prepared these for our experts. So let's start with Brad.
All right, thanks, Max. So the first question really just has to do with summer vacation activities, some ideas so what are some good summer vacation activity ideas, and specifically maybe some things that for families that are trying to save a little money, working on a tight budget, whatever.
Right on. Yeah. So the first idea we're going to hit, and by the way, we have on my CFS page, we have all the resources that we're going to talk about, all the ideas. We have a resource guide for you guys to download. So any information here, if you want more questions about it, I encourage you guys to get the resource guide and download that so you can look back. And of course, if you have any questions, by all means, please email me and I'll be more than happy, or call me and I'll be more than happy to help you out. But the first idea I want to pitch is it's called geocache. If you've not done this before, it's actually kind of a fun deal. As long as you have a smartphone that is GPS enabled, you're able to participate. And you go to geocache.com and you sign in and get an account. They don't send you spam or anything like that or sell your stuff, so it's pretty safe. And what you do with that is there is actually hidden little boxes all over the world. And there are a bunch here in Columbia too. So if you go to the geocache map, you can look at all of the hidden little treasures. And they range anything from a micro, which will be just a little tube with a rolled up piece of paper that you take out, you sign your name to it, and then you put it back in there, and then you go record it on, that you visited this place, till there's one here in Columbia that's a CD exchange. It's an old ammo box. You find it hidden, and you pop it open, and you look at the CDs, and you pick one out that you think is good, and then you leave one that you thought other people would enjoy because you enjoyed it. And so they are, and if you're going on vacation, you're traveling, you can look ahead of time and find where there's, like if you're going to Mount Rushmore or wherever you're going to go. This is a fun activity. My kids have enjoyed that when they were little itty bitties, and they enjoy it now. Because now, and you can even create your own geocache and put it on the map so other people can find it. So it's a fun family adventure. You guys can come up with your own theme and go with that. The next opportunity that is great for vacationing with budgets is if you've got a family that lives in a different area, do a house swap. It takes a little bit of coordinating with getting the schedules put together, but I've got friends that live in Florida, and so we can line the calendars up. That way you've got free place to stay and your friends already, so you don't have to worry about your stuff, but it's a good time to set that up. We also have, my wife and I started doing this last fall. I went through the map of Missouri and found a lot of these towns that have the same name as a different place, like Japan, Missouri, or Cuba, Missouri, Mexico, Missouri. And so what I did is I made a map with a route that we could go around the world right here in Missouri. I've got it set up so that it takes, if you start Saturday morning, about 7 o'clock, you start here in Columbia, you'll make it back through the loop and make it back here till on Sunday evening, about 6:30. And it's a fun time. There's stuff to do in every town. Sometimes it was just take a picture with the sign, say, hey, we made it to Paris. But there's a lot of fun. And that's also in the resource guide. So if you're looking for something like that, you can check that out. And then another thing that we've done before that to help pay for vacations and trips is that whenever we do go out to eat during the rest of the year, we'll order just water, and then we'll budgetize that money aside. And so drinks at a restaurant are, $2.50 a pop. And so every time we go out, then I would just set $8 or $10 aside that we would have spent drinking soda into the vacation fund. And that kind of helps, because then when you go on vacation, you've got a little kitty after you've been saving that up for the year. So that's some tips. And there's more in the resource guide, but that's what we're going to cover for right now.
Well, thanks, Stephen. That sounds great. I'm excited about geocache. Sounds fancy. Well, next, let's hear from Kim.
Hello, Dr. Abudo. I have a question for you, and this question spans the ages. Are there any special precautions I should take around newborn babies? And how do I safely interact with someone who is older but not a family member?
That's a very great question, Kim. So we know that COVID-19 is more prevalent in adults, much more so than in pediatrics. And the cases that we see in children are primarily adolescents. And then there's, a few more cases of children under the age of a year old that we see, but those are typically related to their moms having it. The majority of the time, children who get the disease get it from a close family member. So it is more likely that a child gets the disease from a family member at home, an adult who is sick, rather than them being out and about in the community and getting infected that way. The home exposure is more likely. As far as being around other people that we don't know, the question really is, in case that person gets sick, would there be an easy way for me to have that information and for me to know what the next steps would be? So that's why we really recommend keeping our circles close and in tight as far as the numbers, and being able to have access to being able to communicate with those individuals, because when they get sick, what the health department essentially does is they go back 48 hours before the symptoms and ask them, who have you been around for more than 15 minutes and within 6 feet? And so they have to be able to give your name and phone number for them to contact you. The other thing to look at is your risk of getting really sick. Again, 80% of people who get COVID-19 do fine. They get a mild cough, cold, flu-like illness. But the people who tend to end up in the hospital are people who have underlying chronic conditions, such as high blood pressure, diabetes, heart disease, asthma for kids. And so if you have one of those underlying diseases, then it is recommended to take more precautions than someone who is very healthy.
Oh, well, thank you for that. Well, let's hear from Brad. What have you got for us?
So when I grew up, Dr. Abudo, we played outside a lot. We just were out. We were in the dirt, just out. Is allowing children to be exposed to viruses a real danger, or is it okay to help them, to expose them a little bit to help them build immunity?
I would absolutely let children play. The other day was raining. My children were playing outside in the mud and the rain, and it was fun time. And, every time we go out to the parks, we look for little creeks and they put their little toes in it. And so I would definitely allow them to go out and explore and get exposed that way. What I do not recommend is having what some people deem COVID-19 parties. So because the reason is that we don't necessarily know which children are going to go on and have a more severe disease, because this is a new virus for everybody. So you don't have that sort of community or herd immunity that can protect you. The other reason is that just because they've gotten it once doesn't mean that they won't get it again. And so I would caution against that. But for all purposes, they should be out and about and be playing and do everything that a child should do.
Wow, COVID-19 parties. That's new for me. Wow. Well, thank you for that information. Yeah, definitely want to stay away from that. Well, experts, we're going to go ahead and take a few questions from our team members at home. So we have some questions here. And so Bob S. is asking, says there are so many conflicting messages from Dr. Fauci, originally saying you don't need masks to the CDC, later saying that you should wear a mask. Who are we to believe? And if you can get the virus through your eyes, which they're apparently saying that now, then why are we not told to wear goggles as well?
So I would say part of the conflicting of messaging is that it's a fairly new virus. So we have to keep in mind that this virus is only a few months old. We discovered it in December. So as we learn more and more about it, the recommendations do change and shift over time. And the initial thought was we need to protect ourselves from other people. And so this is where there was a lot of talks around medical grade masks and the N95s and who should have them and who should wear them, which we recommend reserving for healthcare workers or people who actually see sick patients. As far as the general public, the recommendation is to wear the cloth face covering. And the reason is that as we learn more about the disease, we realize that there's a lot of people who have very mild symptoms or no symptoms at all, who then can infect somebody who develops symptoms or gets really sick. And so it is meant to protect others from me when I wear a mask out and about in public. But the masks are not the end all be all, in the sense that it is a mask in addition to. So the first recommendation is, as much as possible, to physically distance ourselves, keeping our circle small, as I mentioned earlier. And when we go out, to try to keep that 6 feet difference between us and other people around us. And if we find ourselves in situations where we can't do that, then the masks provide that additional protection, provided we're also being careful about not touching our face, not readjusting the mask all the time, that the mask is actually above the nose and not under the nose, and that we are doing all the other things too that we need to do in addition to that. The different states recommendation for masks that you see is because different states have different rates. So it's really hard for the CDC to put out a blanket recommendation, because what they're seen in New York or California is not necessarily what we've seen in mid-Missouri. Our rates are still very low. Looking at our Boone County and MU County area, we have a 0.37 per thousand people in terms of case numbers. So fairly small numbers, which is again different from what you see in St. Louis County, where they have higher rates. And so I would say the masks are useful, but it's when we cannot do all the other things that the masks really add on something extra.
Sure. Well, thank you for clarifying that. So actually, Mr. Williams is asking if playgrounds are safe.
Playgrounds are absolutely safe. There were a couple of studies that talk about the virus surviving on surfaces for a prolonged period of time, and you may have heard about it can live on, surfaces for more than 3 days. But those studies were done in very closed, research-driven environment, and that's just not the way that our environments behave. That the temperatures are different, the humidity is different, and so we have not seen a lot of cases related to people being out and about, especially playgrounds. When you add in the heat in those places, that dries out the virus pretty quickly. This is not a virus that can survive for very long. Where we do see exposure is with close family members. So if you're having, a dinner with your family members, or you're having a get together, the fact of sitting together and eating and sharing utensils, that increases your risks much more so than the kids playing on a playground.
Oh, okay. Yeah, I was wondering that too. Well, thank you for clarifying that. Well, we're going to jump back to our questions from our panel here. So Kim, why don't you go ahead?
Yes, we have kids and a lot of students that want to play outdoor soccer and go to soccer camps. How safe are sports right now?
I guess I can take that, and maybe Brad and Stephen can add on. So it depends. It depends on where they're going, and you have to look at, if you're doing some sort of summer camp, to look at where you're going and what the rates they are and what the recommendation is. For Boone County, the latest recommendation that I've seen is that they're allowing some sports, but close small groups, and that they are really trying to limit having teams interplay between each other. I know for Mizzou that they're allowing the football teams and other teams to practice and not necessarily do playing together. So again, the idea is keeping the group small, avoiding that large crowd that you cannot keep track of where they're coming and where they're going. So in case there's a case that develops, it's easier to contact those people and make sure that we can isolate them and test them appropriately.
Thank you. And Stephen, do you know of any alternatives available to in-person camps?
Yeah, you bet. In fact, Matt North might address this first bit. But Matt, would you share a little bit about our Technique football app that you've got with the football team, or soccer team? I mean,
Sure. Yeah, I coach middle school soccer. Unfortunately, we weren't able to have our regular annual soccer camp this summer. But instead of that, we found an app-based training program where we can kind of load our team in there, and we can train together doing the same training exercises and see kind of have a inter-squad competition on who's training the most and who can get their gold medals on their tricks and things like that. It's been pretty fun and challenging, but the app that we're using is called Techna Football, and it's been pretty good.
Awesome. And I also know that Best Buy has a Geek Squad camp, and that covers coding, photography, all kinds of opportunities. And you can go to their website, and that'll be on the resource panel that you can download. There are also, and Matt talked about there's some virtual soccer camps actually available out there that you can sign up for, and they'll have a coach there and run through some drills. There's also a ton of coding camps if you're into Minecraft at all. And again, these are resources that we have available in the guide here. If you'd like to learn how to do stop motion, like with Legos, that's some options in there. A ton of STEM camps. So if your kids are into the sciences or maths or any of that stuff, it's got some fantastic options. There's also idtech.com has got a wide variety of things, anything from how to code, 3D printing, how to do photography. You'll have to go there to kind of check it out. And what's nice about a lot of these websites that we have as a resource here is that they span the age gap. So depending on what level of skill set your kid has, they have got a camp to fit.
Wow, that sounds super fun. I wonder if grown-ups can join that. All right, well, hey, let's jump on over to Brad now.
All right, so this question is for Dr. Abudo. Summer is typically a time for travel for families. So is it safe for me to take my family on a road trip to travel a little bit, or is it best just to stay close to home?
I think travel, it also depends on where you're going. So I would first look at the rates in the cases where you are going. Some states and counties do require the wearing of masks and being quarantined when you get there for 14 days before you can go out and about and do what you need to do. So I would first check there so you don't ruin your vacation. If you go there, you have to stay in the hotel for 14 days. As far as road trips, it depends on the age of the kids. For me, I look at what would allow me to have the least exposure to avoid potentially getting infected. So if you, like me, you have young children, I know that there's no way that we can do a 14-hour trip without multiple rest stops, without multiple bathroom breaks. And, the mere fact of them having to go to a gas station or go to a restroom and touch everything in there before they actually can wash their hands is just daunting. And so for families with small children, I recommend day trips, places where you can go within a couple of hours to, again, limit how often you have to get out of the car. For older kids, you can absolutely go anywhere. Again, if they can wash their hands, they can keep to themselves, they can stay away from people and potentially wear a mask. Those are all things that are recommended. I've also heard some people say if you're going to do air travel, to think about maybe bringing your own lunch so that, sharing with other people, and you can keep your mask on the entire time you're in the airplane so that you only eat during the breaks at the airport to, again, limit your exposure as much as possible.
So as a follow-up question to that one, Dr. Abudo, if my wife and I wanted to get away and go camping, go swimming, just going to the park, what about those kind of activities? Are those safe?
Absolutely. Yeah. And my kids and I, we go to parks, we went to the Stevens sprinklers the other day and kept, distances. So those things are all safe to do, provided you can keep your distances. And again, in younger children, it's a little harder for them to get the concept of you cannot just make friends everywhere you go. But for adults, definitely doing those things and keeping our distances is absolutely something that can be done.
Well, yeah, I have that problem too. I try to make friends everywhere I go, and so it takes some self-control. Well, let's jump on back to Kim now.
All right, Stephen, I bet you have answers to this question. Do you have any suggestions about projects like building things, fun ideas, DIY projects that would be appropriate for 12-year-olds and older that they can do during the summer without parental or very little parental supervision?
Yeah, absolutely. In fact, I highly suggest going on the YouTubes and looking up a channel called Dude Perfect. And this is a group of guys from Texas that have perfected the trick shot, and except they have run the gambit. And so if you're looking for, and what's neat about this is encourage your kids, give them a theme, and say, hey, you have to make a video that's 4 minutes long or whatever, just make some parameters and a goal to shoot for, so you got some measurable, attainable goals. But then just encourage them to make their own trick shot video. If they're into soccer, great, do soccer. If basketball, do basketball. Or you can just do items around the house. And so after you see a couple of those videos, you'll see it. Now they'll need to have a video editing software, and we've got in the resource guide, there's a couple of choices: WeVideo, or of course iMovie if you're on an iPhone. What's nice about those apps is they're relatively inexpensive. But it gives the kids some tools, and they'll learn some skill sets as far as making movies on how to do something like that. Plus, then they get it posted on the socials and engage with their friends, even though they're not together. Another thing we've got, and I hear Dr. Abudo got to do this with her kids, is we have a recipe for finger paints for the car, right? And so you whip this batter up, and then you get to paint the car, and the kids love it. And that one works all the way, the whole gambit from pre-K all the way up to adulthood, because it's fun. Now, I don't recommend you once you do that, leaving the paint on there. I think, paint the car and then take your photos, maybe drive around the neighborhood or something like that. But, before the end of the day, wash that off, because, long term, I would just hate to see something happen to the car. But the initial deal, there's no worry about the finish getting ruined or anything like that. It's just the products in there, if they dry and get crusty, that's probably not the ideal deal. And you also might want to have a conversation as far as, this is the only time we're going to paint the car, just so they don't get any ideas. We also, you can do airplane competitions, and you can break it down into different categories. One, you can just go for distance, who can make the airplane can throw the farthest. You can do trick shots, who can make the plane, do loop-de-loops, or you can come up with whatever tricks you want. You can also go for style, who can make it decorate it, especially if your child is into the arts and making things look nice, who can decorate it or make it look more authentic like an actual airplane. And the last part about this airplane idea that is a lot of fun is you can actually turn your house into an indoor golf course. So you make a plane, and then you set up a golf course. Say you start in your bedroom, and you say you got to go down the hallway, and you got to end up on Dad's recliner. And so then for every throw, you count that as a stroke, and then you just make up a golf course inside your own house, which is a lot of fun. You can take that outside too, but airplanes and wind, then it's kind of a thing. If you can you have to have a contact resource for someplace larger. That's always a fun time to be able to throw those airplanes. We also came up with this game a couple years ago. It's called Guinness. It's a combination of golf and tennis. In fact, I have my Guinness balls right here. And so it's a golf game that's outside. You take your golf club, and whoever calls the game says, hey, let's play this game, gets to make the rules for the first hole. And so using golf balls, of course, you have to, be safe, make sure nobody's in the club distance. But you say, all right, we're going to start here in the front yard, and you got to go around the side, and the golf ball's got to touch, the bush in the backyard. And then you can make up funny rules about it too. Like, say, if you don't say 4, then next time you have to stand on 1 foot and hit. There's more information inside the resource guide about that game, but it's a lot of fun. It's fast, it's easy. You don't have to have skill sets to make this happen. It's a good time. And finally, I'm going to encourage you guys as parents to invest in a glue gun. Now, you want to make sure you go over all the proper safety features with this, because there is an opportunity, that tip, for someone to get hurt. But if you're talking about with the older kids, a glue gun is a great way to make all kinds of crafts. And it's a pretty insignificant financial investment to get one of those things, but it has provided hours and hours of craft time at our house.
Wow, well, that's really a plethora. And hey, Stephen, you mentioned WeVideo, so CFS students have access to that. So for those listening whose students are enrolled, they have accounts that they can use. So that's already available for them. I know this is a little bit out of order, but it's very much on topic. We have Sarah Boyce asking, are there 3D printing opportunities at CFS? A camp would be fun, and I'm happy to address that one. So, Sarah, we had a 3D printer here at CFS this spring. because of our remote learning situation, students were sending in their schematics virtually, and some of those items even got printed. Currently on our remote learning website, we have a page that has a tutorial video explaining how to use that software that students can watch. It's myself and Mr. Blake explaining that to them, as well as links to send in their designs. Now, we currently don't have the 3D printer here. We're partnered with a government agency. It's actually Department of Defense, has an education branch, and they lend it out to us for free. And so we'll be checking that out at the end of the summer. And so if students are creating something on that program, we could print that off for them later this summer. If for others in the community who are watching, there's other places you could get plugged into, I think through the library, where you can get your creations printed off. We have Columbia Career Center has similar services. So we're gonna go ahead and throw that information into the My CFS page. Those of you that join later, we're taking all of these resources, putting them onto our school website. Go to the button My CFS, and you'll be able to review those. So that's a great question. So let's jump on over to Brad now.
So this is another question for Dr. Arbudo, just regarding kids exhibiting symptoms, runny nose, cough, those kind of things. At what point should we be concerned and take them to the doctor?
So for children, I would say the routine still applies. If, you know, the child is more likely to get mild cold symptoms or fevers and get over it, then I wouldn't do anything different. Younger children, of course, we have a little lower threshold for getting them seen. We do have some kids who present with an inflammatory process about 2 weeks or longer after they've had COVID-19. So if you have any child who's having fevers for more than 4 or 5 days, then they definitely needs to be checked out to make sure that they don't have some of those complications that we look for. And I know a lot of pediatric offices around us are doing telehealth visits, so it doesn't hurt to ask them, call in a nurse, and make sure that there's nothing that you're missing.
Great. Thank you, Dr. Arbudo. And then I have a question for Stephen. Stephen, some advice maybe that you have for finding balance in activities, structured time, unstructured time with family during the summertime?
Yeah, absolutely. Yeah. So what I did with my kids during the summertime is we would come up with a reading hit list. And so these are books that I knew would be of value and the kids would want to engage with. So we'd come up with a list, and depending on their reading level, determine how long the list was. And so we matched their reading ability with their list. And then we said, okay, before school starts again, you need to have all of these books read. You need to read them. And then just, we're going to have a discussion afterwards. And that way it also sets up a pretty organic conversation where you can hear their thoughts and how the book made them feel. And what their ideas were about stuff. And you can run that list from, nonfiction to, whatever kind of a fiction style that your child really enjoys. And another thing is to make a project list. That can be anything from a diorama, which is a fantastic learning part. One summer, my daughter and I, we made a diorama on D-Day. And so that was a fantastic time. We did some family history, found out who in our family was involved in World War II. And she could just go to town. She had that glue gun, right? And she had a great time with that. You can also do like a one time, my kids took all their stuffed animals and made a mini zoo in their bedrooms, right? And so they took different parts of their bedroom and set the teddy bears in this area, and they had the tiger over there and stuff. And then afterwards they came and I got my wife and I, and we got the nickel tour of the petting zoo. And the kids really enjoyed that. They made backgrounds for it, using cardboard and paper and stuff like that. That was a lot of fun. You can also get into the stop motion video. You can use clay, or you can use action figures or Legos. And that's something that can really take up a lot of time and doesn't need to be directly supervised, because then they can come up with a storyline and really enjoy that. I know my kids always enjoyed that. So as far as projects in the summertime, I usually would just come up with a general goal and then let them work at their pace to make that happen, because that way they felt empowered, but yet they were still had expectations to keep moving forward, and they got their creative side out, and it was a good time.
Wow, thank you, Stephen. Well, let's jump on back to Kim now.
Dr. Abudo, I have fond memories of visiting my grandparents in the summer. My kids have grandparents who are in their 70s. Can kids ever see their grandparents again in person? And how do we know when it is safe for kids to go to their grandparents' house again? And how do we protect our grandparents, the elderly in the community?
That's a great question. We all know that they are the most vulnerable, who end up having more severe symptoms when they do get infected. So what I first recommend is using technology. FaceTime is available, use that. If you must see them, try to keep that 6 feet difference between the children and the older adults. Or the other thing that I've seen some people do is absolutely not getting out of the house for a good 14 days, which is again the period of time where we would see symptoms if somebody would have it. And then after that 14 days of no contact, they can then easily go and see people. Doing it that way does not necessarily guarantee that you're not infected, because some people can have no symptoms whatsoever, but having that 2 weeks can allow a little more reassurance that I haven't been exposed to anybody, I don't have any symptoms in the last 2 weeks, and so I'm a little safer. But the best thing that I would say is that physical distance, if possible, to keep apart as much as possible.
Yeah.
And just something I just observed in my neighborhood. My neighbor is in his 70s and he has breathing issues. And what he has a granddaughter that loves him dearly. And so what they do is he sets up a lawn chair and a little cooler at the front of the driveway, and he sets up a couple of chairs for his granddaughter and her boyfriend. And so once a week they come over and they have their little chat. They social distance, but they get together and have some FaceTime, and it's really sweet to see.
And it's also better to do it outside, as Stephen mentioned, than indoors. Outdoors is always better than indoors.
Yeah, thank you. Well, Doctor, I think we have time for a few more questions from some of the folks at home. So Mr. Williams has another one. For families needing daycare, what things should they look for in a daycare provider regarding health safety?
So the first thing that I would ask them is, do they have a plan? Do they have a plan for what they do if one of the care providers gets sick? Do they have a way of screening those caregivers on a daily basis for symptoms? And how big are the classes? How big are the areas that the children are being taken care of? And what are the sanitary measures? How often are they cleaning common areas? How often, where are the hand sanitizing stations for children to have access to? Those are all the questions that should go into play, and kind of what is the steps that they would take to notify parents if something was to happen and one of the caregivers needed to be out. And those would help. Again, the majority of children that we see with COVID-19, it seems to be that they have an adult around them that they interact with on a regular basis who has symptoms or who gets sick. So I would focus on the adults.
Yeah, thanks. And I imagine it's very similar for camps. Are there any particular precautions we should look for camps?
For camps, I would try to look for camps that have stable groups. Again, camps that are a week long, where it's the same group of people who are there the whole week. I know there are some camps where they allow people to go in and out to spend the night. So ideally, camps where your children can come home at the end of the day are ideal, and camps where the class sizes are small, so 10 and no more, and you know exactly where people are coming from, and they're all coming from the same geographic area. So you wouldn't want your risk would be higher if you suddenly have people coming from California, New York, Florida to the same camp. And the risk is even higher if people are coming and going, different days of the week. So stable groups from the same geographic area over time is what you look for.
Thank you for that. And that was an additional question from Karen. Now, Mary is asking, when I see large groups of people not wearing masks, not social distancing, it creates anxiety. Are there any tips for overcoming that fear?
It creates anxiety in me too, I must agree. So the first thing is it a group that I'm a part of or not a part of? So if it's not a group that I'm a part of, then I can walk away or social distance myself, then that's what I do. When you find yourself in places where people want to talk to you or come close to you, what I tell them is I step back and I remind them, hey, can you stay 6 feet away from me? Or keeping that conversation very short, so no more than 10 minutes, and then I'm out. So for me, for example, I always carry my mask with me when I go to a store, but I don't put it on unless I'm really in a tight place where people are not following any rules, or I'm in line at the checkout counter, and there's just no way for me to stay away from people. As much as possible in those environments, what I recommend is do pick up, order online, go pick up, or just go for the very specific item that you want, go get it and then come home. And as much as possible, limiting interaction with people when you're out and about.
Thank you. Well, folks, that's all the time we have for today. Thank you, everyone, for this incredibly helpful discussion. As a reminder, the resources discussed during the course of this panel will be available online on our school website, My CFS page. And the recorded version of this panel, along with the links to the resources for you to download, will be available on our Facebook page and YouTube channel later today. Stephen McBee has put together a great collection of all of the ideas that he has shared today. You can download that as well from my CFS page, or get the links from Facebook and YouTube later today. It will have the how-tos on crafting ideas and links to other resources that you can use to have a safe summer that makes memories. We'd also like to mention some other exciting events that will be coming up. Jeannie Shea's retirement party, perfectly safe, socially distanced, will be July 18th at Lamb Park. Please sign up on our Facebook page. If you are not getting the CFS weekly newsletter, then please send an email to Stephen McBee at smcbee, M-C-B-E, at cfsnights.org, and you will get one this Friday. Be looking for that survey, and please send it back to us. We appreciate your feedback. Well, we'd like to thank each and every one of our panel members for taking some time to talk with us about these important issues. Don't forget, we'll send out that survey shortly after this where you can share feedback about this panel. We want to hear from you and plan to continue holding these kinds of panels and covering the topics that you, the viewers, are asking for. Special thanks to Dr. Robudo and to Stephen for putting all of this together for us. This was very informative. I really enjoyed it. Everybody have a great rest of your afternoon and stay safe.